Michelle, thank you so much for joining us this evening. As with all of your colleagues, always so available to help us understand what we're actually looking at when we look at these numbers on a daily basis. A 3.4 positivity rate in the last 24 hours. Is that what we should be looking at as being good news, or is it too early to say?
Yeah, I think it definitely is good news. We've been seeing that positivity rate dropping steadily over the past couple of weeks. So at one stage, beginning of July, it was over 30%. And while the decrease, started quite slowly over the last 3 weeks, we've seen a significant decrease. And I think really positive news that it's fallen under 5%. So we would hope that this would continue. And in the last week, we really have seen persistent and sustained decreases in the number of cases as well as the positivity rate.
Can we safely say that especially KwaZulu-Natal and the Western Cape, who of course the third wave hit them after Gauteng, have they now seen the end of the third wave and they can breathe a little easier? What are you hearing on the ground is leading to these lower numbers, specifically in KZN and the Western Cape?
Yeah, so I think we did see a lot of differences in the provinces this time around with the third wave, and provinces like Gauteng and Limpopo that started the third wave a little bit earlier obviously came down quite rapidly. But we have seen all of the provinces officially exit the third wave, except for the Free State and Northern Cape. So definitely Western Cape and KZN have seen sustained number of cases and have actually reached that threshold of having actually exited the third wave. And we're continuing to see low levels of infections as we did kind of between the second and third wave.
Should we now be, as you said, we've officially seen off the last sort of whip of the tail of the third wave, as it were, should we be turning our focus towards our rates of vaccination, because as we all know, as we've seen the patterns of COVID-19 infections abroad and what we could learn from that, with the festive on its way, a dreaded fourth wave is something that people are already speaking about. How important is it now that we shift our focus and our resources and all of our other logistics towards getting as many people vaccinated as possible?
Yeah, so I mean, you're totally right. I think by the time, we had all our vaccine supply and good vaccine supply, we were kind of hitting the third wave. And I think that was very difficult as we had to, have resources, deployed to the hospitals to see those large case numbers. And now that the case numbers have dropped, our hospitalizations have dropped, I think we really need to put all efforts into increasing vaccination. And like this weekend, I think they had the vaccination campaign on the weekend. And I think that we really need to employ different strategies to try and reach as many as we can in the coming months.
Obviously, there was always a lot of focus in the economic hub of the country being Gauteng, but as you just said, the Free State and the Northern Cape have been worrying when it comes to COVID-19 numbers throughout this pandemic. We've seen the decision that it's in those areas where we have vast swathes of rural areas, and that is why the J&J jab has been sent into those areas, because people can't travel far twice just to get a second jab. What more can we be doing in those provinces to ensure that they stay ahead of the curve as well?
Yeah, so I think we really need to look at innovative ways and different ways to be able to reach, particularly the hard-to-reach areas. And also we want to be able to reach those that are at highest risk. So the elderly, I mean, we've vaccinated a good proportion of our elderly, but we really want to be able to get to them as well. And I think we need to be able to start, using routine health services, strategies like targeting the elderly when they come in to collect their monthly payments, when people come to collect their chronic medications, to try and use those opportunities to be able to vaccinate as well. I think sometimes it's difficult for people to come out specifically to vaccine centres. So if we can try and make use of as many opportunities to reach people, that would be best.
Now, this weekend we saw a big spike in the numbers of people going for the jab. Some are saying it's because it was day 2 of the 18-plus cohort who could go for their second jabs. Others are saying it was down to the Vuma vaccination campaign launched by the president. All of it, of course, is good news. What do you make of that youngest cohort? That really must be encouraging, that will make a big impact in trying to stem yet another tide of COVID-19 infections over the next few months.
Yes, definitely. I mean, we want to vaccinate, obviously, our most vulnerable, but we also want to be able to vaccinate, those who are in the workplace and our varsity students. And so opening up to those age groups have been really great. And I think often those can encourage, maybe the grandparents and that to come as well. So I think at this stage we vaccinated just over 30% of our adult population have received at least a single dose, I think, which is really great. I think just over 20% have been received their full vaccination series. And I think, as you've said, we really need to just prioritize vaccination at the moment, as well as just to, continue educating, trying to allay those fears around vaccination, because really vaccination is the only way we're going to be able to, return to normality. And, in countries overseas, as we've seen with high vaccination rates, they really have been able to leave the restrictions behind and get back to normal life.
Well, speaking of overseas, obviously a big talking point this week was South Africa still being on the travel red list for the UK. There's now been speculation that it looks like we will be coming off it. Of course, it spells very good news for our tourism industry that's been so hard hit. But after almost 2 years of watching this pandemic unfold and knowing that borders and ports are so important in controlling it, how confident do you feel that as we get more and more foreign countries opening up or allowing people to travel from their countries 2 hours without them facing quarantine going back, how careful do we still need to be about keeping an eye on our borders and indeed our ports?
Yeah, look, I mean, we still do need to keep an eye on that. I think, in terms of the UK, I think there's high vaccination rates. So I think that is important to have a look at. And I think, obviously, if people are vaccinated, a lot less chance that they will be able to transmit the virus. And so we would really, be looking towards, looking at the vaccination status as well, as many countries are looking at. We know that there's always the concern with variants which may come across borders. But I think, we've realized that it's really, really hard to keep the variants out of the country. I mean, we saw with the Delta variant, even though we had restricted travel from India, we still ended up having that variant. So I think we need to keep a watch, but I think we really need to be re-looking at some of our guidelines in terms of the future and getting back, into a more normal state, and weighing up those options between obviously boosting the economy and still being careful enough with containing our numbers.
Thank you so much for that. That's Dr. Michelle Groom. She is the head of Division of Public Health Services and Response at the National Institute for Communicable Diseases. Thank you so much for your time.